And I will admit all. Good morning. Welcome to our webinar today. Excited to spend some time with everybody. I'll let Carla kick things off and we'll do introductions here in just a minute, but welcome. We're excited to spend some time with you this morning.
I'm very excited to be here. Thank you so much, everybody, for taking some time out of what I'm sure is a busy day. I still see a few folks kind of trickling in, so but they'll join as they join. We'll probably, for the sake of time, just go ahead and get started here. Topic of today's conversation: denied and drained, solving the 3 biggest problems in patient access. Couple house rules just to be aware of here for the purposes of this webinar. So Eric and I will present here for 30-ish minutes. Feel free to type any questions that you have throughout the session in the chat box. Don't be shy. We definitely will try to keep an eye on that chat box and answer questions as they come through. And then certainly, we'll save some time at the end, 10, 15 minutes for Q&A after the presentation. All right. Agenda for today. So 3 key topics that we will aim to cover here. First and foremost, the impact of denials and understanding the financial strain. Second topic here, uncovering the root cause. So exploring the breakdowns in people, processes, and technology that drive the denials. And then third piece is effective solutions, really trying to target actionable, tactical solutions to address some of these root causes that cause the denials downstream.
All right, so a little bit about Carla and myself and why we feel like we have some thoughts on the topic here. Both of us CEOs and runners of software technology companies focused solely on healthcare. For my company in particular, we really focus on the patient experience, how patients interact and engage with hospitals and health systems and medical groups, what makes those interactions enjoyable and transparent versus frustrating and clunky. So we build software to help manage a lot of those salient touch points for the patient along the way, and have loved partnering with MaxRTE and their team. We've worked with them for some time now. The MaxRTE team focus on helping health systems with their technology to be able to manage eligibility, insurance discovery, and prior authorization. Have some phenomenal tools in that space, and so we found that we can get together and geek out often around, man, how do we clean up all these processes and help patients get in and access hospitals and health systems, and help health systems be able to intake those patients and get paid for the services they're doing. So when we kind of blend our technology together, we've had a lot of fun pulling those processes together to really help clean up how the business processes that your teams are managing and working through, and leveraging our software to help manage all of that. So it's been a very symbiotic relationship and really enjoying all of that. And so excited to talk to all of you today around some of the best practices and things we've learned working with our different client partners on how to hopefully try to manage denials in teams and all that fun stuff. So looking forward to the conversation. Carla, anything you'd add to that?
No, you covered it well.
Excellent. Well, excited to jump into it. So when we think about those impacts on denials, right? How do we create those denials and all that fun stuff? I'll let Carla kind of jump into the numbers here, and then we'll get into people, process, and technology.
Yeah, so setting the stage, why it matters. We all experience anecdotally the pain points associated with denials, both from a process and people frustration and patient standpoint, and also from a financial burden standpoint. But what do those stats really look like? Bottom line here, denials are not necessarily decreasing, they are increasing. So over the past 5 years, there's been a 20% increase in denial rates. And those denials are costly to work. On average, the cost to rework a single denial is $118 on average. And the fresh part of the reason for underpinning the frustration here is that over 50% of denials are preventable. So a lot of these technology tools, processes in place up front to prevent those denials in the first place, it's kind of the key to the castle here. And then kind of looking on the back end, right? So about 60% of denials are never appealed. And 1 to 2% is the estimated net revenue improvement with a strong denials program. So, you know, a couple different sources here, Kaiser Family Foundation and CMS kind of underpinning just across the US and across hospitals and health systems. These are where the stats are. So this is, you know, denials are a very thorny and costly conundrum, and you know, underpinning why we spend so much time and attention on trying to solve some of these problems up front.
What I think is really interesting too with that, Carla, is we see these numbers increasing. However, as an industry, we've been investing tons and tons of resources trying to reduce denials, right? So those increases are on top of a concerted effort to try and manage them. It's scary to think where they'd be if we hadn't been putting so much initiative into trying to manage it.
Absolutely.
So when we think about those investments, right, when we talk about kind of the goal of this webinar, it's that sweet spot between denials prevention and patient flow, right? So we talked about kind of our two organizations and the perspectives we have on how to manage things, right? And from a patient experience perspective, the best thing possible would be they just show up at the facility, they're seen, and they go home. They don't have to go through registration. They don't have to verify insurance. They don't have to do any of that information. They just go and are seen and go home. And that's going to have phenomenal patient flow, right? Patients just come in and go out, and things are great. But your denials are going to be massive, right? You can't bill for anything. You have literally zero information. That's your bottom right quadrant here of the graph here, where your financial loss is massive because you're not literally billing for anything, right? It's that extreme of we've prioritized patient flow and access versus being able to bill for the services that we're doing. On the converse side of it, right, if we look at the top left corner, if we're focused 100% of our efforts on denials management, and we make sure that the patient gets a one-on-one interview with a patient financial counselor before they're seen, and then we have a really tight exit process at the end of their care so that we're making sure everything's covered there, and we really throw all of our eggs into that basket of denials management. It's going to be so difficult to access care that patients never actually even get through it, right? They're just stuck in all the paperwork and minutia, and they don't even receive that care and get through. Either extreme is horrible, right? Either extreme, you're going to have the inability to stay financially relevant in the marketplace, right? The sweet spot is that balance between how do we make it a really good experience for patients and for them to access that care while still gathering all of the information that you need to be able to appropriately bill for it and reduce that opportunity for denials. That sweet spot really comes in the appropriate connections between business processes, the people that are doing the work, and the technology that you're leveraging, right? And so for the rest of today's webinar, we're really going to focus on people, process, technology. You've probably seen it before, but it really is a really good tool to utilize to try and understand the concepts around who are the people doing the work, how are the processes in the work they're doing, what are those jobs to be done, what technology they're leveraging to do it. And if we can pull all three together into a really synchronized process, that's where we hit that market relevance position. And so that's the aim for today, is how do we sit in that channel. So with all that, right, we want to uncover the root cause. And so we're going to look at people, process, technology. On the people side, it's a challenge, right? When we think about patient access teams, there's a little chart on the bottom right. And if you can't read it, it's looking at what's the turnover rate for employees annually by type of employee. So the average entry-level employee has less than a 5% annual turnover rate. So whether that's at entry level at a food services or manufacturing, less than 5% turnover rate annually across the country. When you look at daycare workers, right, they're more like a 15% turnover rate, right? Hospital patient access, 25% turnover rate. Your outpatient medical group, 40% turnover rate for those entry-level patient access positions. That is massive, right? We are burning through teams, which means we're having to constantly invest in retraining those teams and managing with them. What we found a lot of the issues are, initially, when we think about patient access, the core jobs to be done for a receptionist was a receptionist, right? They were answering the phone, they were directing patients through, they might be collecting some basic information, but it's pretty generic processes. Today, your patient access teams are more like mini billers, right? They are collecting all the information. They're checking insurance eligibility and verification. They're confirming prior auth. There's so much work that they're now doing that used to be done by billers and coders. The job description has changed massively. I would challenge you, have you looked at those job descriptions? Are they commensurate with the work they're doing? And is the pay scale commensurate with the work they're doing? If they can make more money at an entry-level job somewhere else, they're not going to stay. And I think that's one of the major drivers we see within patient access turnover rates. We require a lot of them, and we just don't have the right tools to support them or the pay rates and job descriptions to manage really the work that they're doing today, which can be challenging. I'm curious, Carla, anything to add to that?
Yeah, a lot of the challenges and just the reality of the industry and the labor market right now, underpin a lot of the importance of having the right technology and automation in place to be able to rely less on people and more on technology and automation that's already built into the process.
Absolutely.
All right. And then speaking of process, what are some of the root causes and most common process errors that lead to denials downstream? So you'll notice a lot of these root causes happen upstream, right, within the patient access processes. So that's where and why we're focusing the topic of this conversation for preventing denials on front end here. But these top 5 most common process errors come from across the U.S. The clients that we work with, the hospitals and health systems that we speak with every single day. And so a lot of the technology that we put into place and the processes and best practices that we encourage kind of come from seeing a lot of these process breakdowns. So first and foremost, not capturing or incorrectly capturing patient information. So this can happen in a number of different ways, right? This could just be manually keying something in. Of course, a member ID could be fat-fingered in there, or missing the senior or the junior suffix on a patient's name, right? All these small errors where it could just be one miskey can create a lot of headaches down the road. It's important to get that right up front. Number 2, not checking active insurance coverage early enough. So too many times we've seen, the patient has already left the facility, and that's where the eligibility process begins. And by that time, it can be too late, right? If you don't have the perfect information, you get a no match or a not eligible, the coverage has lapsed. At that point, you're trying to call the patient. Maybe you don't have their up-to-date contact information. It just creates a lot of headaches downstream. So making sure to check active insurance, even if it's a scheduled appointment, pre-service, and certainly at the point of service at the very latest, when the patient's right there at registration. Number 3, most common process issue and breakdown leading to denials is not verifying coordination of benefits. And this really cannot be left to the patient to be able to provide their primary or secondary or even tertiary coverage. So it's really up to the provider, it's up to the facility to be an expert at verifying coordination of benefits and really understanding the rules of the road on what to bill primary versus secondary. Cannot rely, and oftentimes need to be educating the patient on kind of what that coordination of benefits looks like. But this is highly complex stuff. It's really easy to get wrong, but very important to verify and get right as soon as possible on the front end. Number 4, not submitting a prior authorization, right? So prior auths are definitely a big roadblock, and not getting that prior auth timely, not submitting that prior auth for the right CPT codes, not submitting that prior auth even to the right payer, right? If you don't have the right primary insurance on place and on file with that patient, or if you've incorrectly captured any of the other patient demographics, that prior auth process also falls apart at the seams. So submitting that prior auth correctly and early is critical. And then number 5, which we're going to spend not too much time on here for the purposes of this conversation, but not appealing denials, leaving revenue on the table, after the denial has already been appealed.
All right, so then finally we look at technology, right? And we can argue whether healthcare is patient-driven or company-driven, right? But really, I feel like a lot of what we do in healthcare is technology-driven. We spend an enormous amount of money deploying an EMR, and then we learn how to leverage that EMR to use it as best we can. But for our people and processes of using that EMR, it can be challenging. But then when you layer on the patient expectations and experience and how they interact with the EMR, whether it's through a portal or text messages or emails or paper documents that are given them, right? There's so many different ways that patients are trying to interact. And within our tech suite of technology, that stack is not just the EMR anymore, right? It's tons and tons of third-party vendors, which is fine because we can come in and we can really help isolate and fix issues, but then you're daisy chaining all those vendors together, right? And so when we look at all of those different technology solutions layered with the EMR, if not put together correctly, you're going to have attrition, right? Data attrition. You're going to have denials go up. You're going to have operational challenges. It can be clunky and frustrating. So it's important to be able to select the right suite of services that really interact and work well together, and to be able to have vendors working nicely together and working with the EMR correctly so that it creates a really good experience both for your administrative teams at patient access as well as for your patients. But that can be challenging. And we're finding often it's not set up right and it's not working correctly. And so being able to get all of that linked up can be a really big challenge. So not to belabor the point, we can move on pretty quickly from here, but technology in and of itself, we have the right tools available. Is it set up right? And is it all hooked together correctly to create that really good experience? So as we think about root causes of people process technology, right? Obviously, there's a lot of issues there. Let's get into the fun stuff, right? Let's start talking about how do we actually start impacting those different areas to really create the outcomes we want of that balance between patient flow and denials management. So when we look at those effective solutions, first, when we want to look at the people process, right? Historically, we've thought about denials management often around, well, we've got, these are the type of denials we're getting, and so we're going to put these things in place, and that's great. And then we sit back and say, we created this great thing, and it's going to be awesome. What we don't think about is how fast moving and fast changing it really can be. The people that are doing the work change often. We already talked about attrition rates being high, right? So you might have had a process, the person that was doing that process isn't there anymore. So you now have to retrain it, right? So the 3 big takeaways we want to look at. First, as denials are coming in, we want to make sure that we categorize them correctly so we can correctly identify, is this a patient access thing? Is this an insurance thing? Where in the chain is this broken? And being able to have that return and report process. How do I get that information back to the boots on the ground in that right area? So looking at the denials, categorizing them out, and having those feedback mechanisms in place so that we can make sure we're adapting quickly and informing our teams, here's what's wrong. All the way down to you know what, patient access is doing awesome. It's a patient access issue, but it's my third shift ER. I'm getting so many denials coming out of third shift. I need to go retrain that specific group, right? Getting that granular on your denial claim data is critical. Part of the way you do that is having those really good KPIs, right? So number two, having that dashboard, whether it's a Excel sheet that you're providing, or whether it's a great tool, the technology that you're logging in to be able to see, here's how everybody's doing, here's their performance, and then making it a positive experience, right? Not going down on the team and belaboring, man, you're not doing this right, but more, do you have the right tools? Do you have the right processes in place? How can we help build this to make it work well? And then finally, understanding that this really needs to be iterative and process. Do we have the right people in place so that as denials shift, that we can respond quickly and be able to bring in the right stakeholders at the right time to address those changing denial causes along the way? All of this blends really tightly then from the people doing the work. What is that work they're doing? And so we want to look now a little bit at what are those processes and how can we help manage that better?
Yeah, one thing I'll add here as well, Eric, the power of just small incentives to motivate teams to focus on denials, right? Of course, you have to be able to report on these metrics. Um, but at the end of the day, if you're reporting on those metrics regularly up through leadership, down through, the individuals, when folks are doing a really good job and they're hitting their numbers, they're exceeding their numbers, little things like throwing a pizza party or, just recognizing staff for their hard work and their success can be really powerful as well.
Absolutely. Yeah, it helps with the retention as well, right? If people feel like they're being effective in their job and appreciated for the work they're doing, the odds they stay are much higher.
Absolutely. All right. Switching gears here to process related solutions. And again, just kind of reminder that these pieces are meant to be highly tactical, right? The problem of denials management and denials prevention, we can spend days, we can spend weeks talking about this. So these are really intended to be tactical solutions that, if you came away from this session with one or two small changes, that would be a success here, right? But just the process underpins, both the people and the technology. Over 25% of denials are actually caused by eligibility related errors, with inactive insurance policies being one of the most common reasons for this type of rejection, right? So a lot of this is you've got the tools in place, you have the people in place. How are we bridging that gap to make sure that the processes support those elements? And so it can be as simple as running eligibility and discovery for all patients without eligible coverage, right? So on the front end, whether it's for scheduled appointments, confirming eligibility at least 7 days pre-service, and then being able to handle those exceptions, right? Having processes in place, work queues in place in your EMR so that staff are working those work queues ahead of seeing the patient, right? So any lapsed coverage, run insurance discovery proactively on that self-pay population so that then, when the patient comes in for their visit, they are then able to verify that you did find the correct active coverage. Whatever the mistake was, whatever the error was, it's now corrected, and the process flows smoothly from there. But definitely being able to use both eligibility and insurance discovery on the front end, so that you can identify that active primary coverage is just really helpful, best practice, and good to have that technology in place on the front end. Also, on the front end at registration, empowering the teams with the training, the documentation, and the processes to also capture secondary and tertiary coverage upfront, right? So this is related to that root cause problem of the coordination of benefits, right? So not just capturing the primary insurance, but also capturing any other secondary or tertiary coverage that might be active for that patient, so that you can be in a position to confirm that coordination of benefits and not leave anything else, no stone unturned.
If I may, Carla,
Go ahead.
one of the hospitals we work with was really struggling with this concept. And what they ended up doing is any of their new patient access hires, they trained them for the first 30 days as a biller. And then they moved them to the front desk, and they found that it helped them connect the why, right? It helped them connect, here's why all of these different coverages matter and how it all comes together. So now they were way more likely on the front end to manage that process correctly.
Awesome. Last point here, verify the correct Medicaid plan is being billed using batch eligibility checks. And then also running insurance discovery on all Medicaid primary patients to locate any commercial coverage that may have been missed, right? So running bulk batches in the background. First of all, it's automated, right? So it doesn't require human touches. And of course, any exceptions, any data mismatches, et cetera, can be spit out into work queues for manual review and processing. But running that in bulk continuously is, helps to put guardrails in place and safety nets in place so that you can catch any coverage that might have been missed. And not just catching things that might have been missed, right? So for example, a commercial plan that was missed, for all Medicaid accounts that you might have on place, but also verifying that that Medicaid plan is accurate, right? Way too many times, there might be an MCO and, or there might be a Medicare Advantage plan on place, right? When regular Medicare was billed or regular Medicaid was billed. So any of these managed plans can be easy to miss. And so just making sure that the accurate plan is on place. And with a simple eligibility check, you'd be able to verify that that's the accurate plan to be billing. And if there's any errors or the wrong plan is listed, you can correct that upfront early on in the process before it gets billed and then denied, right? So yeah, very simple kind of bulk batch eligibility workflows and insurance discovery workflows can catch a lot of these problems that manifest downstream, and just being proactive and setting those processes in place up front can really save a lot of headaches downstream. All right. Technology. So pre-service, again, is the bulk of where we would recommend putting some of these this automation in place. And many of these solutions we've kind of touched on already, but it's very simple, kind of scheduling a batch or automating some of those eligibility checks, insurance discovery checks up front. But some of these small tweaks in your process can really make sizable ROI. So important to kind of check the boxes here. But first and foremost, verifying eligibility in batch for all pre-scheduled appointments. Number one, that is kind of the foundation here, verifying eligibility up front. Second, running insurance discovery for all self-pay scheduled appointments. So this will be upfront, catching any coverage that may have been missed ahead of the patient even coming in for their visit. Third piece here that's important is setting up automated filters to compare insurance covered benefits with visit types. And then hopefully the software that you've got in place at your facility can flag uncovered services, right? So a good example of this may be if family planning Medicaid is on file, of course that coverage does not necessarily align with all visit types. So being able to flag any uncovered visits will help to ensure that the accurate insurance is listed on the file and that any gaps in coverage are kind of addressed with the patient up front. And fourth piece here to ensure that you've got in place with your technology are tools to flag data mismatches when patient demographics in your EMR differ from what the payer has on file. So all too often, with eligibility and insurance discovery, you could have a, Michael J. Smith or a Michael B. Smith, right? And that middle initial can actually make a very, very big difference down the line, again, when you get to denials. So just confirming that the demographics, whether it's a middle initial, whether it's a card ID, whether it's a suffix on the name, whether it's a married versus maiden last name, hyphenated last name or non-hyphenated, all these little pieces, we've really seen that trip up folks. So making sure that the technology you've got in place can automatically flag those differences, call that to the attention of your staff so that you can make sure that those demographics are accurately listed in your EMR. A point of service, I don't want to neglect this here just because of course, you may have staff in the ED, right? In the emergency room, you may not necessarily have the time pre-service to prepare. So having insurance discovery, ideally via an API integration at registration, to be able to locate, click a button and run insurance discovery so that you can populate the active insurance. If those patients are coming in and they're distressed, maybe they're not conscious, maybe they don't speak English, whatever the situation may be, relying on the technology versus relying on guesswork is always going to be the best practice there. And then last point here, again, the topic of this conversation is pre-service and patient access, but post-service, it's important to remember automate daily insurance discovery for all denials, right? So even if you do, you put the right processes in place, you've got the right teams, the right incentives, the right technology, things will still slip through the cracks, and making sure that you're not leaving that money on the table either. Automate daily insurance discovery for your denials, because if it was a COB related issue, if it was an eligibility related issue, it's not too late to make that correction, correct the plan information, identify that correct coverage, and then rebill out the claim and get paid for the services that you've worked so hard to render. So pre-service, at point of service, and post-service, having the right technology in place, having those safety nets in place will help to ensure that you're preventing denials and not leaving revenue on the table. And some of these items here, some of these recommendations are hopefully low-hanging fruit that you can take back to your organization and hopefully reduce those denial rates and maximize your revenue.
Yeah, and I think one thing to think about as well, so we can put all these processes in place, we can have all this technology here to try and capture as much as we can, but there's going to be, you're hopefully going to find those issues, right? You're going to find you missed the suffix, you're going to find you missed something. When you find those issues, you also need to think about what technology you're leveraging to coordinate with the patient, because often you're trying to capture them either before they've come in or after, right? And so they're not physically in the building. So how are you engaging your patients and pulling them in? Are you calling them? Are you texting them? What technology are you putting out there? And one of the things I would counsel, patients interact via text message. 98% of all messages are read. So that even if it's just don't forget to bring in your insurance card with you, that reminder, the vast majority, they're at least reading them, right? How are you engaging with those patients, and what technology are you leveraging to keep them abreast of things as you identify those issues is critical as well.
Absolutely. And I do completely agree with that. And last point I'll make here is all of you, if you're watching this, that's half the battle, right? You care about improving these processes, maximizing the revenue for your organization, and delivering seamless patient care. So that's half the battle. And hopefully some of these solutions are tactical enough for you to take back to your organization. And with that, maybe Eric, if you've got any other final thoughts to wrap up here, but certainly if you've got, in the meantime, any questions at all, we'll open it up to the group here. Just type them into the chat. Happy to address any questions as they come up.
Yeah, as we give you a minute to type those in, healthcare is messy, right? When we think about patient access and all of the different things we have to do, it can be messy, it can be overwhelming, it can be a struggle to try and check all those boxes, right? It's easy in a webinar for Carla and I to get up here and talk about here's all the things you should do and life will be wonderful. When you go to actually deploy it, we all know that's where the rubber meets the road, right? That's where the challenges come. You've got 10 patients in front of you. All of them don't feel well. All of them are trying to get in to be seen. Your patient access team is doing the best they can to get all the things they can. Um, the struggle is real, and we get it, right? And so a lot of this comes down to we can give you here's some of the generic best practices. Here's the things that you should be thinking about. But ultimately, you're going to operate your patient access teams way different than anybody else, right? You have your specific EMR that you're using, your specific challenges, your specific processes. All of those come together to create that experience that your team and your patients are going through. Um, One of the things that Carla and I love doing is sitting down and understanding all those problems and taking it apart and trying to figure out what's the right solution for this situation you're dealing with. So as you think about these best practices we've shared, by all means, feel free to reach out to us. We love chatting with folks and understanding what are the challenges you're trying to address and what are some ways that you can get around that. So by all means, please reach out with any of those questions or concerns, either here in the webinar or afterward. Welcome to jump in.
I'm getting a message on the Q&A. All right, it's a question from outside of the chat here. This person is saying it's not letting me type in a question. So maybe just for a moment, Eric, maybe take a quick look at that. But the question is on what are some prior auth best practices? So we spent a lot of time in this discussion talking about eligibility related denials, COB related denials, and of course, prior auths are a big source of denials as well. And a big pain point for organizations. We could spend an entire webinar, an entire session talking just purely about prior auth best practices. So that is a broad question. But I would say step one for prior auths is definitely getting automation in place. Too many facilities are still relying on phone calls to payers to submit prior auths, relying on disparate portals, right? So navigating across different payer portals and even faxes, right? Some payers receive submissions for prior auth via fax. So I would say probably the most important item to keep in mind with prior auth, kind of step one here, is just making sure you have a solution in place to automate that, right? Automating the submission of prior auths, automating the back and forth with the payer on prior auths, right? Because oftentimes the payer will come back, you're missing medical records, you're missing a modifier on a procedure code, whatever the case may be. Having a centralized solution where you can have oversight, right? Supervisors, managers on the team can monitor those prior auth kind of submissions and making sure that they're tracked all the way through to completion. Ideally within your EMR, of course, right? So hopefully having all of that information tracked in one place and fully automated in one place is the goal here, right? Because it's very easy for auths to slip through the cracks when they're done on different portals or staff are calling.
Absolutely. From a just quick technology check, it looks like Q&A is enabled. If for some reason you can't, apologies, we'll have to take a look at the Teams, but it looks like everything's turned on. If you're trying to send us a Q&A and it's not going through, Carla and I's email addresses are on the screen here. Please feel free to shoot us an email. Happy to address those in a one-on-one setting if it's giving you challenges there. But One thing too that we often get when we start to think about all of these different channels coming in that potentially create denials, we'll find the right ways to manage them. But think about the different channels that are coming in, right? So there's the pre-service group that you have doing proactive outreach to patients for scheduled procedures. You have your teams that are managing at point of service as patients are coming in. You have referrals. You have all these different potential touch points of patients coming to you seeking for care. It can be a challenge to make sure that those experiences are the same between each of them, right? We'll often deploy, well, we're getting a lot of denials with getting the wrong eligibility in here. And so we're going to go fix this, and we'll fix it for patient access on point of service. But we'll forget to go look at referrals. We'll forget to go look at what our pre-service team is. You often have lots of disparate processes happening, and we don't always apply the solutions to all of them correctly. So looking at all those different touch points is definitely something that we recommend just reviewing with a team and making sure all are covered.
Absolutely. All right. Well, if there are no other questions, then I think we're right nearing at the 45-minute mark here. So just want to thank everybody for taking some time out of your busy day to learn about denials prevention and some of the tactics and tips that we recommend to make sure that you're not leaving revenue on the table.
Absolutely. Appreciate you all very much. And thank you again for spending time with us today. We appreciate it. If you have any questions, again, send it to us, and then happy to make this recording available for those who request as well.
Thanks, everybody.
Thanks all. Take care.